Have you ever measured your blood pressure, noticed it was a bit high, and then reassured yourself by thinking, it's okay, probably just fatigue? Many people over 60 think this way. But as a neurologist, I want to warn you, even a slight and sustained rise in blood pressure can quietly damage the blood vessels in your brain and increase your risk of stroke. In fact, many strokes don't come from sudden severe spikes in blood pressure, but from mild repeated increases, especially during sleep times of stress or after salty meals. In this video, I'll clearly explain when blood pressure starts to become dangerous, the difference between systolic and diastolic pressure, and most importantly, how to manage your blood pressure daily to prevent the gradual damage that can lead to stroke. You don't need to be afraid, just understand your body and take the right steps. Let's explore this together now. First, what exactly is high blood pressure? Generally, hypertension is diagnosed when clinic readings consistently measure 140/90 mHg or higher. For home monitoring, the threshold is usually 135/85 mHg or above, while a 24-hour ambulatory blood pressure monitor considers an average over 130/80 mHg as hypertension. A common question is whether these thresholds change with age. In fact, diagnostic criteria for hypertension remain the same regardless of age, although baseline blood pressure may vary slightly between individuals. Significant deviations without an underlying cause are not considered normal. So, how does high blood pressure cause stroke? A sudden severe spike in blood pressure can exert strong pressure that causes blood vessels in the brain to rupture, leading to hemorrhagic stroke, a dangerous form involving brain bleeding. On the other hand, chronically elevated blood pressure damages and stiffens small blood vessels, promoting atherosclerosis, narrowing arteries, and restricting blood flow to the brain, which leads to ischemic stroke or cerebral infarction. Any blood pressure consistently above 140/90 mHg significantly increases stroke risk, and the higher the pressure, the greater the risk. There are two main types of stroke: hemorrhagic, due to vessel rupture, and ischemic, due to vessel blockage. Ischemic strokes are more common, but hemorrhagic strokes tend to be more severe with higher mortality and more complex treatment. High blood pressure is the leading cause of hemorrhagic stroke because sudden excessive pressure overloads and breaks brain vessels. What habits or factors push people with high blood pressure closer to stroke? One dangerous behavior is when patients feel their blood pressure is stable and stop or change medications without consulting their doctor or continue using old prescriptions without follow-up. Some even take unregulated drugs or use others' prescriptions without medical advice, posing serious health risks. Another common misconception is that high blood pressure only affects older adults, causing many younger people to neglect monitoring and delay treatment, thereby increasing their risk of serious complications. Understanding the link between blood pressure and stroke, learning how to monitor yourself, and adhering to treatment can help you manage your health effectively, reduce stroke risk, and protect your brain. Recognizing stroke symptoms quickly is crucial for timely intervention and minimizing brain damage. Whether it's an ischemic stroke or a hemorrhagic stroke, early warning signs are often similar and easy to remember with the acronym FAST, F-face. Look for facial drooping or an uneven smile. A arms check. If one arm is weak or drooping when both are raised. Starting S speech. Notice. If the person's speech is slurred, difficult, or they cannot understand. So, T. Time. Time is critical. Call emergency services immediately if you notice any of these signs. If the person has a history of high blood pressure and shows stroke symptoms, family members often give blood pressure medication on the spot. However, this is not recommended. Lowering blood pressure during the acute stroke phase must be carefully evaluated by medical professionals. In hemorrhagic stroke, rapid blood pressure reduction may help limit bleeding, but in ischemic stroke, lowering blood pressure too much or too quickly can worsen brain damage by reducing blood flow. Therefore, never adjust blood pressure yourself when stroke is suspected. Instead, get the person to an emergency room or specialized stroke center as soon as possible for proper diagnosis and treatment. For basic first aid when you suspect someone is having a stroke, call emergency medical services immediately. While waiting, lay the person down, ideally on their side, in the recovery position about 45 degrees, if possible, to prevent choking if they vomit. Loosen tight clothing, check pulse and breathing. If the person stops breathing or has no pulse and you're trained, prepare to perform CPR. Now note the time symptoms started and any observed signs to inform medical staff. If the person is on any medications, try to bring them along so doctors can understand their treatment history. We often hear about the golden hour in stroke treatment, but the time window varies by stroke type. For ischemic stroke clot-busting drugs, thrombolytics are usually effective within 4.5 hours from symptom onset. Mechanical clot removal can be performed within 6 hours, sometimes longer in special cases. For hemorrhagic stroke, early intervention to control bleeding and reduce brain pressure is crucial to improving outcomes. In all cases, reaching medical care as quickly as possible can be life-saving. A common question is why someone can still have a stroke even while taking their blood pressure medication regularly. In reality, stroke occurs due to a complex combination of factors: medication adherence, how well the medication fits one's age and personal health condition, lifestyle changes like diet and exercise, and individual biological factors. No treatment guarantees 100% stroke prevention, but strictly following a comprehensive treatment plan can significantly reduce the risk. On the other hand, when multiple risk factors combine with unhealthy habits, stroke risk remains high even if the patient takes medication consistently. Controlling blood pressure can be more challenging in certain groups, especially older adults and those with underlying conditions like diabetes, chronic kidney disease, high cholesterol, or other endocrine and cardiovascular diseases. In older adults, levels of hormones like renin and aldosterone often decrease along with reduced salt excretion, making them less responsive to some blood pressure medications. This complicates blood pressure management in this group and requires close monitoring. So how can stroke be effectively prevented in people with high blood pressure? First, good blood pressure management is the top priority, involving continuous treatment and monitoring. Next, treating associated conditions like diabetes and high cholesterol is also very important. A healthy lifestyle, including a balanced diet, appropriate physical activity, and avoiding harmful habits helps lower stroke risk. Importantly, patients should avoid common mistakes such as stopping or changing medication on their own when they feel better or when blood pressure seems controlled, and should not use old prescriptions without regular checkups. It's also crucial to correct common misconceptions. Some believe that if they feel healthy, high blood pressure doesn't need treatment, or that medication alone without lifestyle changes is enough. These beliefs are dangerous because high blood pressure, even without symptoms, can cause serious long-term damage. Regular follow-ups help detect problems early and ensure treatment plans are properly adjusted. Especially for younger people with high blood pressure, identifying underlying causes is necessary to choose the most effective treatment, thereby reducing stroke risk and other complications. Experts consistently emphasize that high blood pressure is a major risk factor for stroke. If you have a loved one living with this condition, being well prepared and equipped with the right knowledge is crucial to protect their health and respond effectively when needed. First, make sure they have a reliable home blood pressure monitor to check regularly and promptly, especially in urgent situations. Next, always keep prescribed medications on hand to avoid interruptions in treatment. Equally important is that the whole family understands and recognizes stroke signs using the FAST acronym, a simple but effective tool for early detection of dangerous symptoms. Knowing basic first aid for stroke victims is also essential, helping you act quickly and correctly while waiting for professional emergency responders. This preparation can make a big difference in saving lives and minimizing stroke damage. In today's video, we've covered vital information from understanding dangerous blood pressure levels and spotting stroke symptoms to the importance of fast, accurate action. Remember, high blood pressure is a silent killer, but with knowledge, proactive management, and a healthy lifestyle, you can significantly reduce stroke risk for yourself and your loved ones. If you found this video helpful, please subscribe for more useful health content and share it with those who might benefit. Most importantly, if you have any concerns about your blood pressure, consult your healthcare provider. They will help you create the best treatment plan tailored to your personal needs. Thank you for watching. Stay healthy and see you in the next video.